Welcome, everyone, and this is the wellness segment of our show, Fresh, and we are in the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta. And Dr. Bryan, good morning to you.
Good morning, Craig. How are you this morning?
Good. I think it's time for an update. We haven't been in your office for a little while, and we're going to talk about a couple of very important things today as it relates to problems that maybe some of the viewers are having at home. And when we talk about dental medicine, as we do here in your office, Doctor, we're talking about dental care, but also goes well beyond that, doesn't it?
Well, I think many people, when they see the term dentist, they think of teeth. And granted, that is our primary role. However, I think the way the teeth and the oral cavity and the function of the jaws are a very important part of dentistry. And certainly, it is our practice. We belong to the American Academy of Craniofacial Pain, which is an academy that specializes specifically in problems with the jaws, the cervical vertebrae, the entire neck above, and consequently the dental aspects of that, of bad bites, missing teeth. All of those aspects come into play when we're looking at headaches and facial pain and that sort of thing. So the academy has been put together. There's about 600 or 700 of us in the nation that deal specifically with these problems. To become a member, you have to have 400 hours of continuing education after you graduate from dental school. You have to have treated 250 cases of what we consider TMJ problems. And to become a fellow in the academy, that's where we are. So it's specifically for those more complex dental issues. And I've been a member of the academy now since 1992. So it's been a few years. And I think that we are very fortunate to have helped several people that have these problems. And I want the populace to know that these things are available and that when they think of dentistry, they can think of more than just teeth and cavities and that sort of thing. As well, we all also belong to the Academy of Dental Sleep Medicine, which is somewhat related because obviously we've talked before about the appliances that we can use for sleep apnea and snoring. So those are also kind of an adjunctive academy that we also belong to.
Well, it adds a lot of validation to what you're doing here in the office, and we're going to take a look at one piece of equipment here, Doctor. It's called the T-scan, and it's really part of the protocol, isn't it, of finding out what you can do to help the patient that's maybe dealing with some of the issues you've talked about.
Right. The T-scan is kind of a nice modern technology to show us exactly how people's bites are related to maybe some of the problems they have. It shows us exactly where a bite may be off, where we could see a prematurity on one side, heavier bite on one side than the other, which will throw the jaw joint off, and of course the muscles back of the neck as well. And so it gives us a very, very good view of what's going on inside the mouth, rather than just utilizing, let's say, a carbon paper bite, where you can't see any changes in one tooth over another. I'll demonstrate.
Sure, yeah. I'm amazed at the technology here. And we were kind of kidding before we went on, but the numbers of equipment you have here, it seems like every time we're here, we find a new piece of equipment that further aids in what you're doing to help the patient.
Well, this is one of our major pieces of equipment that's, like I say, very high tech. We utilize a little bite fork like this. And this bite fork is placed in the mouth. I'll show you here on my hygienist, Joey. And here you can see we placed this in earlier, and you can see the bite over time. Now, what we'll do is we'll wipe that out, and we'll have Joey bite into this bite fork. And bite tight. Good. Thank you. And there you can see the bite that we have on this. It shows us several things. First of all, this red mark means that she's hitting very hard on this back molar here. We know exactly which tooth that is. And we can see that it's much harder than the rest by the color. If we were to take and do this in a 3D, we can actually see by this graph which teeth are hitting the hardest adjust those teeth down so that the bite is more even all the way around.
It really becomes a science, doesn't it?
Oh, indeed. Yes, indeed. And that's the beauty of the technology now. It allows us to see the specifics of each individual tooth and even the cusps in those teeth and where we need to adjust the bite to make it even.
And an uneven bite can cause all kinds of problems. Sleep apnea is the one that you've talked about, but other kinds of problems, that TMJ issue, all kinds of things.
Well, the major thing that we see when we have bites that are, let's say, very one-sided or hit in the back, we get headaches from that. Many times people will grind their teeth at night. Their body subconsciously wants to reduce that high spot, and they'll end up grinding their teeth to grind these little spots down and end up with a lot of muscle problems and a lot of issues like that. So this indeed helps us in those individuals that have that kind of problem.
All right. Well, Doctor, a fascinating issue here and a topic, and one that we'll probably continue talking about at some point in the future. I want to thank you for your time and, of course, invite people at home. If you have any of these kinds of things going on in your life, you need to contact the offices, again, of Dr. Norman Bryan and Dr. Anjana Gupta and their Office of Dental Medicine here in Elkhart. Doctor, again, good talking to you.
You too, Craig. Have a good day.
Thank you. We'll be back in just a moment. Stay tuned.